Hey, everyone. I am going to give you guys a few minutes to see that I'm live so you can make your way onto this live. I got lots of information to give out to you today. So I hope that you all are ready. So yes. When you see this, come on in, say hello. Hey, Jamie. Hey, come on in and say hello. Dee, hey. All right, we got some good information today. What's up, cousin? Hey, Momo. Yes, I got some. So today, you guys, hey, Naive. So this week is being dedicated to all of our other STDs. Hey, Erica. So we're doing all of our other STDs today. So today, Tuesday, we are going to be talking about, hey, Miriam. Hey, Reese. Brenda, everybody. We're going to talk about 3 of the most common STDs. 3 of the most common STDs, all right? So we are going to be talking about gonorrhea, genital herpes, and chlamydia. Gonorrhea, genital herpes, and chlamydia. Thank you, Momo. Look, I'm almost about tired of this little side swoop. I think I'm going to take this down tonight, so it could just be hanging or whatever. You see it's coming out the little thing. I'm getting a little tired of it now. You know I like change. I can't keep it like this too long. I might end up taking it down today and keep acting funky. All right, so yeah, 3 of the most common STDs. We got gonorrhea, genital herpes, and chlamydia. So that is what we're going to talk about today. Make sure you guys, if you don't know this information, you might want to listen. A lot of people get a lot of misinformation when it comes to especially genital herpes. Herpes is one of the STDs that has the most confusion. So we're going to talk about that one second. So make sure you're paying very close attention. All right. So you see I got my notes here. Got my pen, laptop there if I need to go over there. All right. So starting out with gonorrhea. So gonorrhea is one of those STDs. You know that is a if you are sexually active, you are at risk for gonorrhea. Okay, nobody is protected from getting gonorrhea. If you are having sex, you're at risk for getting gonorrhea. Okay, let's put that out there first. Now there is a strand of gonorrhea that is resistant to the antibiotic used to treat gonorrhea. This is called the antibiotic resistant gonorrhea, okay? And we're going to talk about that a little bit. Now, when it comes to with gonorrhea, there are more than 500,000 reported cases per year, okay? Did y'all hear that? In 1 year, there's a reported 500,000. That's 500,000 reported cases yearly. But they estimate that about 1.6 million people actually yearly are getting gonorrhea. So the reported cases are 500,000, but there are over 1.5 million people who are probably actually contracting gonorrhea. Okay? Yes, very shocking. So what is gonorrhea? All right, so gonorrhea is basically an STD that can infect both men and women. It can be caused. Let's see. It can cause infections on your genitalia, so your private area, your rectum, and your throat. So genitalias, your rectum, and your throat, and your mouth. Okay? So you can get gonorrhea in your mouth, in your rectum, in your genital areas. Again, like I said, it's a very common infection, especially between the ages of 15 and 24 years old. Those who are between the ages of 15 years old are some of the higher rates of getting the gonorrhea infection. Why are people so uncomfortable about STDs? Have you heard about the new strand of gonorrhea? They have. So that's the one I was just talking about, Princess Flowers. If you just popped in, the new strain of gonorrhea is called the antibiotic-resistant gonorrhea. It had the antibiotics do not work on this strand. So if you get this strand of gonorrhea, it is there. It is not going to go away like the quote-unquote regular gonorrhea. Okay. How is gonorrhea spread? Gonorrhea is spread vaginal, anal, and oral sex. Vaginal, anal, and oral sex. Pregnant women can also spread gonorrhea to the baby during childbirth. Okay? How do we reduce the risk? Hey, just don't have sex. Don't have sex. You know what I'm saying? I'm just saying, just don't have no sex. Right, Monique. So that new strand, the strand that is resistant to the antibiotics, that one doesn't go away. It is non-curable. Yeah. And, you know, you want to make sure you're getting tested and you're using condoms. So those are ways to reduce the risk. You are so welcome, Keita. And yes, Reese, very interesting, right? Look, I wish I could, like, I should have printed out a picture, be like, look, this is a picture of how gonorrhea looks on the vagina and the penis. But I'm not going to do that. Y'all, you guys can Google and see what the actual infection looks like on the infected genitalia. All right, so signs of gonorrhea. This is the part you guys want to listen to. Signs of gonorrhea. Now, remember, these signs can also mean lots of other things, but these are also clues if you are sexually active, okay? Signs of gonorrhea for men. For men would be a burning sensation when you pee, white, yellow, or green discharge from the penis. So if a guy is experiencing white, yellow, or green discharge from their penis, and also men can experience painful, swollen testicles. Now that part is very rare. It's very rare for a man to experience testicle swelling or pain, but it is there. And so for women, pretty much kind of the same for women. You're going to have a burning sensation when you pee. It's going to have an increase in your vaginal discharge. But also with women, it can cause vaginal bleeding between periods. So if you start bleeding and you're like, wait a minute, it's nowhere near time for my cycle to start. What's going on? Yeah. And then with rectal infections, now this would be for both men and women because we both have rectums. In the rectum, you would notice discharge. You would notice anal itching, soreness, bleeding, and painful bowel movements. Okay? So just keep those in mind when thinking about, you know, how would you know or what would give you a sign. Can gonorrhea be cured? Absolutely. The normal strand of gonorrhea, the regular strand of gonorrhea, can be cured with treatment, with the right treatment. And then again, that one strand, the resistant strand, of course, there's nothing they can do about that one. Now, if gonorrhea is left untreated, for women, it can cause scar tissue in your fallopian tubes, which would make it harder for you to conceive. It can cause ectopic pregnancies, and it can cause long-term pain. For men, it can cause men to actually become sterile. And again, those painful pain in the testicle tubes. So not necessarily pain in the testicle, but in your tubes going into your testicles, it can cause pain there. Okay? So before I move on to the next topic of genital herpes, does anybody have any questions on gonorrhea? Oh, I'm already doing that one, Princess. We got a whole week. Let me see what day I'm doing that one. We're going through all the STDs this whole week. We got 3 today, 3 tomorrow, 3 Thursday, and 3 on Friday. So tomorrow we're gonna be talking about PID. So I got you, girl. I got you. Shimmy, shimmy, shimmy. Look, so tomorrow we're going to talk about bacterial vaginosis, human papillomavirus, and pelvic inflammatory disease. And then Thursday we'll do syphilis, hepatitis, and trichomonas. And then Friday we'll do 3 other types of STDs, which let me see. I could tell. I abbreviated, so it's LGV, MG, and EI. I can tell you exactly what those abbreviations are. Give me one quick second. So we're going to talk about, well, I can tell you we're going to talk about, oh, I got to add cancroid on it. Oh, sorry. Cancroid or chancroid, I don't know. So there's 4 we're going to do Friday. So chancroid, we're going to do lymphogranuloma. Lymphogranuloma venereum is another STD, LGV. We're going to do mycoplasma genitalium, another STD. And we're going to do ectoparasitic infection. So basically like let me say it right. Pediculosis. I always get tongue-tied. Pediculosis pubis or pubic lice. It's basically pubic lice. And scabies. So we're going to talk about all that on Friday. All right. So pubic lice, scabies, and you know, we're going to talk about that Friday. So just want to make sure we know that. So let me see. Anybody have questions again about gonorrhea? If not, we're going to move on. Thank you, thank you, thank you. Thank you, Pansy. Let me get on here with you. Yes, teamwork, baby. Teamwork. You in junior high school, Keita, girl. Yes, come on, let's get this junior high school. All right, let's go to herpes. This is one that listen, I want you guys to really pay attention, okay? With herpes. Why? Because so many people have misinformation about herpes, and I'm going to give you the tea, okay? So, what is genital herpes? There are 2 types of herpes. This is where we're going to start. There's 2 types of herpes. HSV1, which is your oral herpes. So cold sore, fever blister, that type of thing. And then HSV2 is going to be our genital herpes. So oral herpes, most people in this world at some point has been in contact with oral herpes or HSV1 if as early as a child. That's why they say don't let everybody kiss on your baby. Yeah, don't let everybody kiss on your baby because you don't know where their lips been and what's on their lips. Okay? That is how younger kids were given HSV1 or herpes simplex virus 1 as little kids. And when they become adults, they might have cold sores. They might have whatever on, you know, wintertime you get cold sores, fever blisters. Yeah. So that is common. Most people in their lifetime has had at least 1 cold sore in their mouth or something kind of, you know, cold sore, fever blister. I don't think I've had, no. I done had some dry chapped lips. That was about it. But yeah. So oral herpes can be spread. Listen to this, okay? Oral herpes can be spread from mouth to genitalia through oral sex. So you can infect someone with herpes if you have HSV1 on your mouth and you perform oral sex. Okay? Let me say that again. If you have oral herpes, fever blister, cold sore, you can spread that virus to someone's genitalia through oral sex. Which is why most of the cases of herpes originate from oral sex and HSV1. Okay? Most of the cases originate and generate from oral sex, mouth to genitalia transmission. And it is most common in the United States. Why? Because y'all too doggone friendly. Stop kissing on people. Stop kissing on the babies and the children and all that stuff. Okay? Because I'm the first one. Where you might, I don't let my kids eat. I don't even like to eat behind my kids or drink. Number one, they backwash when they drinking. So I don't want your little crumbs all up in my juice and my water and whatever. Anyway. So we ain't sharing off rip. Anyway. You know. So yeah. And 1 out of 6 people have herpes. Are you listening? 1 out of 6 people have herpes. And the age range, the most common age range is ages 14 to 49. Ages 14 to 49. All right. How is herpes spread? How is genital herpes spread? So it's spread from herpes sores. So whether that's oral or genital, herpes sores, saliva, or genital secretions. Now, if it's skin, so skin in the oral area, let's see, skin in the oral area, what I wrote, look, I can't read my own doggone handwriting, Lord Jesus. I was writing fast, y'all. I was like, I gotta get these notes. Hold on. That's why I got my laptop right here. So if I can't read what the heck I wrote, because I write like a little old boy. That's what my mama said. Oh, you write like a boy. I don't care. All right, let me see. Did my thing freeze up on me? Oh, Lord, don't tell me. Oh, exit page. Let me open it back up, y'all. Sorry. All right, herpes. Because I definitely can't read my handwriting. I was rushing. And I was like multitasking too. All right, so if your partner has oral herpes infection, skin in the oral area can have, if the skin in the oral area has the herpes infection, or if the skin in the genital area has the herpes infection, you can get it either way. Okay? So if the infection is present, whether it's oral or genital, it can be transmitted. All right? And you can get it from, now this is the part, listen. Okay? You can still get herpes even if your partner has no physical signs of herpes. You know how they always say, oh, you can't spread herpes if there's no outbreak. That is not true. No, regardless of a person actually having an outbreak or not, you can still transmit or contract the herpes virus. Okay? Okay. All right. We on the same page. Boom. All right. Any questions about genital herpes? And of course, you know, how can you reduce the risk? You know, if you're in a relationship, you want to get your STD testing done. If you're in a relationship with a person and you know they have genital herpes, you can lower your risk by making sure your partner takes their anti-herpes medications every day. Or, you know, just avoid sex with them. Just avoid having sex. Just don't have no sex. Just go be a nun and just don't have no sex. Okay? Well, I always thought a person had to have an outbreak to pass it. No. No, no, no. And then also, this is another one. I'm going to read this verbatim because I want y'all to hear this. Be aware that not all herpes sores occur in areas that are covered by latex condoms. Also, herpes virus can be released or shed from areas in the of the skin that do not have visible herpes sores. For these reasons, condoms may not fully protect you from getting herpes. Okay? Do you need me to read that again? Beware that not all herpes sores occur in the same area and occur in areas that are covered by the latex condom. Herpes virus can be released or shed from areas of the skin that do not have visible herpes sores. For this reason, condoms may not fully protect you from herpes. I tell people this all the time. Condom is only covering the area that it's covering. If someone has herpes in their pubic area, in their groin area, especially oral, nobody ain't wearing condoms on their mouth. So the possibility of it transferring to you even with a condom is there. If the person never takes their medication, so for example, if herpes is left untreated for women, let's see. All right, so it can cause painful sores, and it can be very severe for people who already have a compromised immune system. If you touch your sores or fluids from the sores, it can be transferred to another part of your body, okay? Even your eyes. So say you go down there, you scratching, you don't know you got herpes, you go up here, you scratching. You can transfer that herpes around your body. Okay? If it goes untreated. Pregnant women can have problems. Their babies can have problems. Some babies can be born infected with the herpes virus. It can cause blindness in babies. So there's a lot of risk involved with leaving herpes untreated. Herpes infection is also it can be a co-infection. So a lot of times people who are diagnosed with HIV, sometimes they also get a herpes diagnosis. I can tell you guys right now, I am only HIV positive. I just went yesterday and let the GYN play in my cooter. And I got my test results back and everything negative. I don't have no gonorrhea. I don't have no chlamydia. I don't have no none of these. No trichomonas, nothing. All's negative. So you want to go and get checked. Make sure y'all are getting these STD tests done. You know. All right. So last one we're going to talk about, and then we'll be done for today, is chlamydia. Chlamydia. So no one can touch me. Girl, look. I don't be hugging on people. I don't be shaking people's hands like that. No. Hey, how you doing? Head nod. What's up? What's up? What's up? What's up? How you doing? Hey, how you doing? Yeah. Don't touch me. Oh, God. I don't even like hugging. But sometimes, older people, your grandma and aunties, they be wanting to hug. And I just be like, oh, Jesus. Yeah. All right. So, chlamydia. Again, this is another one. I love you too, Melody. Another one of those common STDs. This one also in women can cause, well, not really just in women. Men and women, if it's left untreated, it can cause infertility. Women under age of 25 and older women with risk factors need to be tested yearly. Okay? In men and women, it can also cause, like I said, it can cause reproductive issues. It is spread vaginally, anally, and through oral sex as well. Male partners can spread chlamydia even if they don't ejaculate. So you know how sometimes people say, oh, well, they can't give me an STD because they ain't even come, or they didn't ejaculate, or they ain't nut. Whatever term you use, even if a man does not ejaculate, come, nut, whatever the word you want to use, you can still contract chlamydia. Now, chlamydia is curable. Chlamydia is curable. And even if you get the chlamydia infection once and it's cured, you can get it again. You get it over and over and over again. Okay? Symptoms of chlamydia for women would be that discharge, burning when peeing. Symptoms for men, discharge, burning when peeing, and also that pain in the testicles. Both people, men and women, if it's a rectal infection, it can cause pain, discharge, and bleeding. Okay? And let me see what else with chlamydia. That might be it with chlamydia, y'all. Chlamydia is not all that complicated. When we start getting into PID and bacterial vaginosis and all those other ones, then it's going to be very, very detailed. It's going to be a lot. Let me make sure. All right, you guys, you have any questions about any of these STDs that we talked about today? So we talked about gonorrhea, genital herpes, and chlamydia. If you have any questions, let's talk about it. Let's see. And again, all of this information that I am giving to you guys, can be found on the CDC's website. Just Google CDC STD, and you will find the section where they discuss all STDs, you guys. All right. Any questions? Tomorrow, I'll be back on here tomorrow at 1 o'clock. We are going to talk about, what's tomorrow's topic? We're going to do bacterial vaginosis. We're going to do human papillomavirus, pelvic inflammatory disease. And then again on Thursday, the other STDs that are a couple of non-curables as well would be syphilis, herpes, trichomonas is on Thursday. And then Friday, those others. How come we don't hear about these STDs anymore? Honestly, you don't really hear about them because everything else is kind of getting overshadowed. So HIV overshadows most STDs. When you hear the word STD, you think HIV. You don't think, people aren't thinking the smaller ones. So that's kind of why things are getting very, overshadowed. Look, bacterial vaginosis, listen, that's one of those STDs that you can get without having sex. Yeah. You can have BV without having sex. Okay? But we're going to talk about that tomorrow. That's going to be our first one that I'm going in that order. Bacterial vaginosis, human papillomavirus, and pelvic inflammatory disease. In that order. Tomorrow. So, yeah. You're welcome, Martha. You're welcome. You're welcome. Hey, Alicia. Hey. All right, you guys. So, if you guys have no further questions, I am going to get off of here. You're welcome, Reese. Gonna get off of here. I bought me a planner today because I just have to have some organization going on. I'm doing lives on here. I'm on this app called Speakeasy, which is a video, audio kind of podcast app. I'm on that app. I'm in a collective, a group of collectives called the Blue Circle, with a guy named Chris Bivens who actually works for BET. We have a collective group on there called a Blue Circle. So we are doing shows on there. Everybody has shows scheduled on that app throughout the week. And so I'm on Thursdays. So this stuff that I'm doing for you guys today, I literally won't be doing this stuff on there until probably a couple weeks later, because I'm going to be doing the whole fresh start on there. Thursday, I'll be doing my introduction. Then next week, I'm going to go into basics of HIV and AIDS. I'm going to do that whole start over on there. So I'm going to post it in the group for you guys can actually come and join Speakeasy. It's a very new app. It's still in alpha and beta testing. It is way better than Clubhouse and all these other apps. It has a video option. It has a chat room at the bottom. So like how you guys are typing while I'm talking, you can see me on there. I can be on camera. You can type and I can see you. And I can invite you to be a guest. And then you can be on camera as well. It has a little section where I can put you in a Q&A queue. Only the first person in the Q&A is able to speak. Once that person's done speaking, I move them out of the Q&A. The next person is up to speak. It is so organized on there. I love it, you guys. So I'm going to post that in the group. If anybody wants to come, I believe they do both iPhone and Android. A guy who created the app, the name is Ty Lopez and Dr. Alex. Ty Lopez actually, he's behind like Pier 1 Imports. He's behind, remember that dating app called Zoosk? He created that app. Like, he's very well known, and he knows us on there, which makes it even more amazing. So yeah, but thank you guys so much for joining with me today. And I am going to also post this video on YouTube. I'm going to download it and post it, so it'll be on there as well. Thank you guys so much. You guys have a wonderful, wonderful Tuesday, and I will see you tomorrow. Bye.